support groups who it's clear are really pivotal in being a guiding light for families and raising that awareness. We started at the start of this conversation about how critical this time factor is. And I think that's where you and Daniel can really come in terms of the awareness work you're doing. So Jo, can you kind of just give us a little bit of a background on the landscape of what currently exists for families in terms of support?
So in the UK, there's TTP Network, which is the patient support group that I founded 25 years ago this year. And so we provide a website with information that's checked by clinicians. Everything's very factual. We have a private Facebook group where people can talk to each other. And we also have a buddy scheme, which is a one-to-one peer support for people in the UK. But our Facebook private group is open worldwide. So we have visitors and guests from all over the world. And we are this year having a conference for the first time for patient members and their families of the TTP network. But actually prior to that, there is a hospital in the UK that has a patient day every couple of years, which has just grown year on year. It's been going for over 10 years, but each year it gets bigger. And that's a really important, that face-to-face meeting for patients, because they may not have heard of anybody else that's had this condition.
Absolutely. And we were talking just before we started this webinar about the peers, the buddy system that you have. So I'd love you to explain that, because I think, especially from what I've heard, from Anis and from Claudia, the importance of having that connection. So I'd love you to explain a little bit more about that, if you can, first, Jo.
Yeah. So what we have is a little pool. It's not huge, a little pool of volunteers who say that they're happy to buddy up with newly diagnosed patients. And when we have a newly diagnosed patient, we ask them if they'd like a buddy, and whether they'd like that buddy to be someone who's at a similar stage in their journey, or somebody who's been a lot longer diagnosed, somebody of the same gender or a different gender. So we just ask a few questions around that, and then we hopefully buddy them up with somebody. They both get asked to read an agreement, which is just setting some boundaries around this buddy system. And then the primary buddy has the opportunity to share email or telephone or by text, and they can set the rules as to how they want to communicate with the other patient. And it just gives that, it's a little bit more personal, because some people aren't happy to put their story or their questions onto a Facebook page. And in fact, we're going to be moving away from Facebook later this year. We're going to be going into a more private setting to have these group discussions for that very reason. But yeah, the buddy scheme is just very much having that one-to-one peer support, so that you can ask those questions that you just maybe don't feel you want to discuss with your family or friends, fear of worrying them. But equally, you'd maybe not think it's important enough to ask your clinician.
Yeah, I adore this scheme. I think it's so valuable, and it's definitely something that could really be replicated across other rare diseases. And I think, as we talked about before this call, that burden that can be placed on the charities and support groups who are often either caregivers themselves or have the condition. And, it's clear from this conversation how traumatic that can be. So to have to absorb everybody else's angst can be really debilitating. So having that mechanism to sort of share the load, I think, is just so good, and such a great way to make your organization more sustainable and kind of alleviate some of that risk of burnout. So I think I really commend you for that. I think that's a great scheme. Daniel, can I come to you in terms of the work that you're doing and how you're connecting your community, and what the landscape is like for you with regard to support?
Well, Nicola, first of all, let me briefly introduce a little bit about FEDEMO, because FEDEMO was founded in 1971 as the Spanish Hemophilia Society. In our origins, we are really focusing the people with hemophilia and other bleeding congenital disorders. But several years ago, we expanded our scoping, trying to support people living with TTP or PTI. And nowadays, we are really focusing in this area, because as in our country, there are no society as in UK TTP network, where people, the TTP community has any kind of support, neither for the public sector, neither for an NGO. As you saw now, it's quite complicated for the healthcare system to psychological bring support to the community living with TTP. and we as an NGO, we have the ability to psychological support the community. We organize a project called Proyecto Púrpura. Purple program is a tricky name because in Spanish the purple is the same name as the purpura, as the disease, and we have a program every material is in purple, trying to make a little bit of awareness about the disease, and we have a highly trained team working exclusively with people with the TTP community. We have one psychologist and two social workers bringing psychological and social support with the TTP community. We organize face-to-face meeting with the people living with TTP, and also we bring the psychological session with people living with TTP, trying to bring some tools living with TTP, and for sure our social worker team was bring social support with the TTP community, for example, to the recognition of the disability or some financial supports that the healthcare, that the public system brings to the TTP community. But I need to recognize it's not easy to make a strong TTP community in Spain, because Joe previously mentioned that in UK there are 9 centers treating TTP, but in Spain there are more than 50 centers treating TTP. It's quite complicated to make a critical mass of people living with TTP in this universe of a lot of centers. Some center has a small number of patients, and it's complicated. We are nowadays trying to make some regional chapters in the biggest hospital, trying to make to bring the sense of community for the people living with TTP. For example, there are some people with TTP that doesn't know any other people living with TTP. When people living with TTP knows other people with TTP, they say, well, there are more people with TTP. I the only one. I don't know other TTP patients. It's kind of complicated nowadays. We are working, making the TTP community, because as I previously mentioned, we have the support programs, but nowadays we are trying to bring more sense of community to people living with TTP.
I'm interested whether, do the clinical, so you mentioned that over 50 clinical centers, do they play a role in trying to work with you to connect those families? Because, you know, it seems to me really sad that any patient should think they're the only one, and that perhaps the clinical team are not doing a good enough job to signpost to say, actually, you're not the only one, because that's a really empowering thing to know in the first place. And actually, here is where you can connect. You know, is there that kind of signposting happening, or would you say that's work still to be done?
We need to recognize the support of the healthcare providers in the program. In some cases, healthcare providers refer the patients to our society. And also, we have a formal agreement with the scientific society, with the Spanish Society of Hematology, and we are seeing an agreement trying to make our very force working with the community. The problem is not the ratio of the healthcare providers. In my humble opinion, the problem is there are a lot of centers, in some cases, a small center treating people with TTP. It's kind of complicated to create a critical mass of patients. But healthcare providers are nowadays they are referring patients to us. For example, as Dr. Chaturvedi previously mentioned, when you discharge a patient, you have the ability to have several follow-ups, maybe every 3 months. But some physicians told us this patient needs at least 10 sessions of a psychologist. But I don't have the ability to arrange the session in my hospital. But we have the ability to bring the patient the psychological support, and some healthcare providers are referring us patients because we have the ability to bring that kind of support. Or for example, I remember we are also offering some patients to totally free of charge is physical rehabilitation for patients with TTP, got some pains in the knees or other kind of joints, and we have that kind of ability. Healthcare provider are referring us some patients.
Wonderful. And Joe, can I just come to you to ask, I know, so both of you have mentioned about the importance of these sort of centres and multidisciplinary teams. How do you feel that really helps? What are the benefits, would you say, of having that holistic approach to the care of patients here?
It helps in England because there is a protocol that goes along with those specialist centres. So there is an agreed way of working, an agreed best practice. They have a monthly, it's probably a two monthly meeting of all the centres, where they can discuss issues that they might be having perhaps with ambulance transport, because there's also been agreements made with the ambulance service that this TTP will be treated as critical as a heart attack. So if there are blockages there, they can unblock those challenges as a group, which is a stronger voice. They can. They also have a regular meeting where they look at near misses and critical incidents to try and unpick what could have been done better there. And I think that's really powerful, and what it's going to provide. And we're still really early days because some of the services were only commissioned at the very end of last year. But what the hope is, and what I am starting to see, is that there's much less of a postcode lottery, which we often get in England around healthcare. And patients are going to be getting consistent treatment, whether they're in the east, north, south, or west of England.
That's fantastic. Just to say to anyone that's listening, if you did want to ask a question, do pop them in the chat, and we'll hopefully get to those at the end. I'd like to end actually on a question that I think I'd like to ask to everyone, actually, because I think it's really important. And I'll start with you, Daniel, and that's just in terms of awareness. So I think we're really starting to understand how important it is for the healthcare professionals to have good awareness for that early kind of interaction, but also maybe for people to identify this in themselves, so that, like Anis, they are empowered to say, actually, something else is going on here. So Daniel, what part do you think awareness from a charity point of view comes into that, and who are you targeting your awareness to? Is it healthcare professionals? Is it general population? What's your strategy for that?
Okay. Well, we're really focused trying to make awareness in the healthcare providers, because as you know now, TTP is a real rare condition, also a life-threatening condition, a time-dependent condition. The quickly diagnosed and of treatment is a key aspect in the outcomes of the treatment, because we have an agreement with the society to the emergency rooms and making some protocols to quickly diagnose people with TTP. This is our main focus. But for sure, we also are making awareness to the general population and also to the payers. Because also now there are a promising landscape of new drugs or new ways to treat TTP, and also we need to make accessible to the people in Spain the new drugs in the TTP, and trying to make that drug reimbursed for the public system. We also need to make some awareness in the general population, and for sure in the payers. But at least in this moment, we are really focused in making awareness in the healthcare providers, in the emergency room mainly, because we need to quickly diagnose and quickly treat people with TTP, because the outcomes is much better when you are treating and diagnosing in a quickly way that kind of rare condition. But for sure, or the TTP the International Day of TTP is for us one of the key events in the year. We organize a huge roundtable, a huge press presentation. It's really important to try raising the awareness in the general population, but focusing at least in that moment in the healthcare providers.
Thank you. And I can see Dr. Chattavahadi, you're really nodding to that. So and from your point of view, how do you think we can kind of amplify the efforts here to really raise awareness with healthcare professionals to make that early interaction really improved?
You know, you're asking the $1 million question here. How do we make people think of TTP when it could be 100 different things?
Yes.
You know, it goes back to medical education. And I actually do think it is getting better, because we are training the upcoming generation of physicians, quite well in these conditions. And we talk about them again and again and again. And I have seen in practice that the time to diagnosis is coming down. For example, last week, I was really impressed that we had a patient who showed up and was on the plasma exchange machine in less than 2 hours from hitting the door. It is a testament to the ER doctors who recognized it, called the hematologist quickly. Now, I do recognize that it is a bit of a tall ask to ask for every family doctor and every ER doctor to be thinking of TTP first, because realistically, they may never see it. But if we can just get to a point where they're aware that it exists, and even more importantly, know when is the right time to get in touch with a hematologist, which should be with any patient with unexplained thrombocytopenia. If we can educate our hematology workforce about the importance of looking at the blood smear and thinking of TTP if they're called, I think we'll go a long way. A long way to avoid the misdiagnosis of, like, for example, ITP, as Ms. Manx mentioned. That is going to help. The other, perhaps even lower hanging fruit, is to make sure that anyone who has had TTP once never relapses again. And that's a little bit easier because, telling the whole world that you may have TTP is not going to serve any purpose. However, the people that already have been diagnosed once, getting them plugged into the right care with the monitoring and the preventive treatments is likely to prevent most, if not all, relapses, which is still a huge achievement there. Yeah. So, education for healthcare professionals to try to get them to think of it sooner and call for help sooner, I would say. There are lots of doctors across the country, in the United States and across the world, that are willing to help even long distance if needed. If there are questions, if things are not quite clear, and just to think of it. But advocacy plays an immense role from the patient and caregiver standpoint to ask to be plugged into the appropriate care so it doesn't happen again, like Claudia said.
Yeah. Thank you. We've actually got some questions coming in, which I think most I'm going to direct to Joe and Daniel. So, but I would like to just come to Claudia and Anis just on that again from a patient perspective. So, Claudia, do you think, obviously having gone through what you've gone through, do you think awareness would have made a difference? How important do you now feel it is to have that awareness against, in the general population, so people understand more? And that when you're going into hospitals, there's more understanding. You don't have to sort of explain everything. What's your perspective on that?
Yes, I do think awareness is it has helped me now more. And when Selena does have any type of, she's been into Emerge a couple of times. The minute, we've only had one episode where we had a staff member tell us that, oh, that's a very common condition. And I remember just saying, no, it's actually not very common. And by the time she made it to the back and the physician got to see her, the physician was like right on top of it. As soon as she heard TTP and as soon as she saw Selena's medical history, she was doing all the appropriate blood work and reaching out to hematology right away. So I think the awareness of it and speaking up when you need to, just let, for example, that particular person say, hey, no, it's actually not very common. I think you might have it confused with ITP. TTP is a very critical condition that's very rare. So yeah, I do think the awareness has helped more, and it will help us in a future event if we need, if we're going to see it again. But I always have that hope that we'll never see it again.
Absolutely. And Anis, in terms of the psychological impact, I think that's certainly something that's come through very loudly to me, is that actually how deep that impact is. What more do you think could be done in terms of awareness to make people understand that this is something that runs really deeply in terms of that trauma, and how we can support patients with that side of things on top of just the physical journey?
I think just patients just telling their doctors, just spreading that awareness. Also just within the patient network of just letting them know that they are not alone. With me hashtagging and sharing my story, I've met people all over the world. And the thing is just making sure that you're heard and listened to, because there's a similar story with women that look like me in my complexion of not being heard. And so I just want to make sure that let them know that you are heard. We are here together, and the more voices we have, we will be seen. So, just make sure that we're heard and we're seeing, and just to talk to each other, because a lot of people can't understand it. It's a different kind of diagnosis than other diagnoses. So,
absolutely.
Yeah.
Thank you for that, Anis. Right, I'm going to go to the questions, so we've got time to fit those in. So we've had one here, which I think Might be one for you to answer, Joe. It says, do the patient group leaders feel the pressure burden of their role, and how do you balance your responsibilities and cope with burnout? What support do you need as an organisation? So probably for you and Daniel, but let's come to you first, Joe.
Yeah, I think it would be very easy to get completely overwhelmed. Although it's a small patient group, there's so much to be done. And in fact, I will link back to your previous question about awareness. I don't see it as TTP Network's responsibility to make haematologists aware. And in fact, under the specialist centres protocol, there's a particular role within the specialist centres, a clinical specialist nurse or clinical nurse specialist, and part of their role is to do outreach work with their local district hospitals to make them aware of the pathway and what TTP looks like. So that's very much in their court. What I see our role is to help patients be self-aware and to monitor themselves and to have regular checkups and to make sure they're well cared for. So that answers that. So yes, it could be overwhelming. I think the one thing, and I'll be very brutal about it, is funding. If we had funding, adequate funding, we could staff this organisation on a paid basis, not relying on volunteers, which is what we do now. And we could actually invest in being proactive around supporting patients, rather than actually what we are is fairly reactive. If a patient needs support, we go to them, but actually we could be doing so much more if the proper funding was there. And I'm sorry, that sounds quite crass, but that is how it is.
Absolutely. We've got someone on here who is actually an ATTP patient, which is great. Fantastic to know we've got some of the community listening, and they've said they'd like to know how they can get involved in forums like this and involved with the work that you're doing. So Daniel, how could people get involved if they wanted to be involved in the work that FedHemo are doing?
Well, if you are a patient living with TTP in our country,
difficult to say, I'm not sure, but say for example they were, how might they get involved?
Well, the best way is to write at purpura@fedhemo.com. You are the ability to make a voluntary agreement with FedHemo, and you are really involved in the FedHemo's work. And for sure, we are searching a TTP ambassador in our country, trying to get more involved in the board of directors of FedHemo, because any people living with TTP in Spain, please write me an email, because we are really searching with a TTP ambassador, because it is one of the key activities for the year.
Wonderful. And I guess the same for you, Joe. Just get in touch with TTP Network and find out the different avenues of how they might get involved.
Yeah, absolutely. We do focus on patients in the UK and Republic of Ireland, but we certainly have conversations with patients all over the world.
Wonderful. Thank you so much. Well, I'm really mindful of time. So I'd just really like to say I sincerely appreciate everybody's being really open and candid, and I think it's been such an education, and very loud and clear comes forward, of course, the importance of that early diagnosis, transition being a really big gap here, and we've got to do better. We're talking about it at every conference and every platform, but we've really got to do better with that transition. But I think also really embedding that psychological support, because many rare diseases are very traumatic, and it's clear that this is in particular is a very traumatic condition in that kind of acute situation, and also the fear factor, learning to adjust with it. So really important to have that embedded. So I really want to thank everyone for joining us today. Really appreciate all of your time. Our commitment is that, of course, this is not just one conversation. So this will be available on demand. We will make this into a series of shorter videos, so that there's legacy to this content, because what's really important is that lots of people, as many as we can get to read this and to watch it and to learn it. So I think it's really important we get it in front of certainly as many healthcare professionals as we possibly can. So, we'll be committed to doing that moving forward. Obviously, we'd like to thank all of you. Thank you to Sanofi for supporting us in bringing this really important discussion to everyone today. And if anyone has got a question that they haven't asked, do feel free to reach out to us, hello@rarerevolutionmagazine.com, and we can direct you to any of the panelists or answer any questions and signpost you to any of the groups that have been speaking today. So thank you so very much to everyone, and have a great rest of your day.